Thank you. I was here last year at this very same meeting presenting to you appropriate use criteria for the treatment of lumbar degenerative spondylolisthesis, LDS, and their application on a large patient population. Can you hear me? And we unfortunately had to conclude that although the criteria could notice and identify some differences in treatment response to the treatment given, they could not identify the patients who would benefit most from surgery. And we said we would investigate further and try and find out which factors could help. And that's what we did. And this is the aim of this current study. Identify whether certain subgroups of patients experience greater benefit from surgery compared to conservative treatment for LDS. This study was based on the data set from the previous study I mentioned earlier, containing demographic and clinical data, as well as patient-rated psychological distress. The main outcome was the COMI, the Core Outcome Measures Index, that was filled out at baseline and 12 months after treatment. We used a one-to-one matching, propensity score matching analysis. For each patient, a probability of getting surgery was calculated based on a constellation of baseline variables. Then for each conservative patient, an equivalent surgical patient was taken, a patient with comparable, with a similar probability of getting surgery. This was done for all 179 conservative patients, and this ensures balanced groups in terms of potential confounders. Then for all matched patients, a two-way ANOVA was run to investigate if some subcategories of baseline variables would influence the differences in outcome between both treatment groups. For this, we looked at the COMI change score between baseline and 12 months for both the surgical group and the conservative group. The difference in change score between both groups, represented by the green arrow, was defined as the treatment effect, the TE, and represents the benefit of surgery over non-surgical care. Coming now to the results. Overall, after matching, surgery yielded greater improvement in COMI score than conservative treatment. So the mean change score was 3.1 versus 2.6 points between groups. And we wanted to see if this difference was even greater for some subgroups of patients. We could see that the treatment effect, so this difference, was greater for patients younger than 70 years old. This can be seen in this graph, showing the COMI change score for the older patients, for both conservative and surgical patients. And just as a note, a positive COMI change score means an improvement in symptoms. As you can see with the green line, the difference between change score between surgical and conservative treatment, this is greater for the younger patients than for the older patients. This was statistically significant and was 3.7 points versus 2.1 points. And this was the only factor that was statistically significant and had an influence on the treatment effect. In conclusion, we could see in this study matching surgical and conservative patients that overall surgery yielded better outcomes than conservative treatment. The improvement in COMI score was greater, and this benefit of surgery was even greater for patients younger than 70 than for older patients. this should be kept in mind for treatment decision making. Our next step will be to try some further modeling using machine learning techniques to try and uncover hidden patterns in data. Maybe factors interact with each other in a way we haven't understood yet, or they may be nonlinear relationship. Thank you.